19 Health Alert. Urgent cares and student health centers near college campuses are seeing a steady increase in sexually transmitted infections and diseases.
Now, there's also a spike in rates for STIs in the fall when students return to campus. Jen Pichano reports.
When young people are away from home and away from primary health care providers they grew up with, they head to urgent care centers when something isn't right.
Urgent care tends to be one of those kind of front doors for people to seek their medical care, and especially for something like concern for an STD, or also known as STIs, in these younger populations.
Dr. Andrea Gamalva is the chief medical officer for Experity. That's a company that provides electronic medical records at more than 3,500 urgent care clinics across the country. They see more than 40 million visits a year. Their medical records show a 60% increase in sexually transmitted infection rates from 2021 to 2022, a 75% increase in those same sexually transmitted infections from 2022 to 2023. And while there was less of a spike from 23 to 24, a 35% increase, it is still a continued rise. And this year is no exception. Year to date, Experity has already seen 200,000 positive STI tests. They finished last year with 250,000. Those most at risk are 25 and under who are sexually active. The most common STIs going around right now, gonorrhea and chlamydia, which require a repeat test 3 months after diagnosis. But they are treatable with antibiotics.
We are living in a time and a day and age where we can treat these infections, and it's so important to make sure that you're taking care of your health, because if you don't treat these types of infections, they can lead to things like infertility and further complications in your bodies.
In Ohio, it doesn't seem to be those under 25, but people in their 30s and 40s where they're seeing a steady increase in chlamydia cases. Cuyahoga and Franklin counties with the highest rates, according to the most recent Ohio Department of Health report. Dr. Gamalva wants to remind young people that any risk for exposure from a partner is reason to be tested and treated, even if they aren't experiencing symptoms.
But women tend to be more symptomatic than men. Men tend to be carriers and not even aware that they have these infections or are transmitting the infection as well.
Students at local universities can get test results quickly and non-invasively from urgent cares and student health centers, sometimes the next day, and they can often be treated by the very same clinic. Jen Pichano, 19 News.